care of that.
Okay, yeah.
So how is this going to work? Can you just like go through it for me? Because this is all new.
Definitely.
For sure. So this video call is going to be recorded. It's being recorded right now, and Liz can walk you through our plan for today.
Okay, so video is recorded for our members, and they will be watching it later on YouTube. And pretty much we're going to have a series of questions for you, interview style, but we've put them into the format of Who Wants to Be a Millionaire. I'm not sure if you know that game, but it's just a short slideshow, and we'll present you with the questions and give you an opportunity to elaborate about your experiences as a dentist and outside of dentistry. Okay, so
Awesome.
Rita, would you like to share your screen?
Me? Okay, for sure.
Or actually, I could do it right
Yeah, you can do it as well.
Okay.
Crosby, I can hear you more clearly than I can hear Liz.
Yes. It's because it's through a phone call.
I can.
Yeah. So
Okay.
basically, I guess I can read the questions to you if you think you can hear me better.
Can you
yes.
see the screen that I shared?
Can you see the screen that we've shared with you? It's the screen. It's
on the computer. Can you see the Who Wants to Be a Millionaire introduction?
Okay, I'm having a really hard time hearing. So
can you hear me, Dr. Kotecha?
Yes.
Okay.
Yes, I can hear you.
So do you see the screen right now that we have on? Okay,
yes.
awesome. Awesome. So we are gonna start. We are gonna ask you a series of questions, and it's in the format of Who Wants to Be a Millionaire, meaning that as we go along, the questions will have more monetary value and they will be more exciting regarding your dental career.
Awesome.
For sure. So
do I have lifelines?
Yeah, for sure. So basically our plan was for me and Liz to read these questions for you, but since there is like a trouble in the communication, I will be reading the questions for you.
Please. Yeah. Thank you.
So is that okay, Liz, if I go for the question?
Yeah, definitely.
Okay. So let's just start. We can start the Okay, so our first question for $100 is, can you tell us where were you born?
Okay, so I was born in Tanzania.
Wow, nice.
Cool.
That's exciting. So we're going to talk more about your background on the next question.
Yes.
So can you tell us a bit about what did you study as an undergraduate degree, how you came to Canada, and then alternatively, what it led to your decision to pursue dentistry?
Nice. That's you're taking me way back now, undergraduate. So I graduated I majored in biochemistry. I graduated in 1997. That's a long time ago. And I went to school in Boston, Massachusetts. I was in the States. And then I went to dental school. So I was in Boston. I went to Harvard School of Dental Medicine, pursued dentistry there. And once I graduated, I met my husband-to-be, and that made me, come to Canada.
Oh, that's.
So I've been in Canada since 2001.
Oh, awesome, awesome. So we are going to talk more about those stuff next one. So I guess our next question for $300 is about where you studied dental medicine, which you already told us was Harvard School of Dental Medicine in Boston.
Yes.
That's awesome. So how was your experience there? Can you tell us a bit more? How was the vibe there? I've heard there they have combined classes with the medical school. So
that's correct.
So can you tell us a bit more about your experience? How was it for you? Was it difficult? Like, it's an Ivy League school for sure, number one. Did you do any research?
Yeah, it's definitely a competitive program from what I remember back then. And one of the reasons I actually chose to go to Harvard was the combined classes with the medical students. So the first 2 years, we actually studied more and worked harder than all the medical students. So we would take all the classes they did in the morning. And then in the afternoon, we would go to the dental lab where we were with the typodonts and doing dental classes and doing head and neck, focusing on head and neck stuff. So it was a lot of work. And Harvard is definitely noted as a research, heavily focused on research institution. So we had to do a research project and a thesis in order to graduate. And it's also very helpful and was very useful at that time because it focuses on problem-based learning.
Mm-hmm.
So we had a lot of cases and we would have to work as a group to solve a case, just like a doctor in private practice. We have a patient, we have to treatment plan, and we have to treat the patient. So we kind of got that learning on problem-based, investigate, what the differentials would be. And yeah, it was definitely fun. It was a fun time. I learned a lot, and it was a good experience for sure.
Oh, that's really interesting. So speaking of having combined classes with medical schools, did you ever like to maybe change your mind midday and study another part of the body rather than head and neck, or how was that experience for you?
Yeah, I knew that that's what I wanted to do before, because when you asked me earlier, when I was an undergraduate, I was considering maybe a pharmacy school or optometry school and dental. So those were the three things I was pursuing, more because I wanted to have a nice work-life balance since then. So I took all the entrance examinations and I applied to different schools. But when I shadowed a dentist, actually, 3 weeks, I figured that that's really what I wanted to do. I shadowed a female dentist, and she had a really good experience watching her, how she worked in her private practice. And she was a good mentor. So that's when I decided I'm going to go for dentistry. And then while in dental school, definitely they fortified the fact that that's what I really liked.
Wow, that's awesome. That's really exciting. Glad to hear that. So our next question for $400 is about your residency. We were wondering, where did you complete your residency, and if you can maybe expand more on it, that what did you do? Was it a helpful experience for you right after dental school or not? And I would appreciate if you talk about that.
Yeah, definitely. I think I'm going to end up being rich because I remember this one as well. So for $400, the answer is D, Brigham and Women's Hospital.
Great. Good job.
Please lock the answer. Yeah. It was a general practice residency, and I highly recommend dental students graduating to do either a GPR or an AEGD. I loved it. It was really like after you graduate, first day as a resident, you're wearing your white coat and everybody's in the hospital looking for you to sign off on a patient that presents with anything head and neck. So from a student, next day you graduate and then you are supposedly an expert in that field in the entire hospital. So we learned a lot. Seeing trauma patients, patients who wait for weeks and months before they come back with cellulitis, abscesses, broken teeth, and they show up or call at 3 in the morning.
Wow.
Go figure. Yeah, so that was us, every third night we were rotating. So it's pretty intense, not like private practice. But you once again learn a lot in a group setting because we would present cases to the fellow residents and other residents would present their cases and working up the patient, treatment planning. You have a lot of help. Mentors are there to guide you. And then you rotate in different departments and then you get a lot of exposure.
For sure. I know that's really
a question on my behalf. If you can hear me, Rizbeh?
Yes.
Do you mind asking Dr. Rina? I'm curious, was it was it a simple transition from the residency to private practice, or did you find many differences, or did you find that that experience had actually really strengthened your skills to work on your own or as an associate?
That's a very good question. So the answer, transition is helpful, very helpful in terms of clinical skills. Because you graduate from dental school doing very few procedures and you take a long time. And in the residency was the first when I started picking up speed and seeing more patients, you know, from 2 patients a day to like 8 patients a day, you know, so you drastically improve on the skills. The second point about transition is the whole staff management, private practice management, insurance management. That's a whole different ballgame that nobody teaches us or prepares us really. So that is a work in progress, and people, you know, we are still trying to figure a lot of things out. But as you start working in a private practice, you start learning the ropes about it. Unfortunately, we don't have a lot of preparation in dental school. I wish we had more of that.
Sure. That's really good advice. Awesome. So our next question for $500 is, what kind of dentistry do you practice on a routine basis? Because as you know, dentistry is a very big field and not all general practitioners do everything. So we were wondering, do you have any favorite procedures or what you do most often compared to other procedures? And we have 4 options for you, but really if there is anything else we can add.
Yes, so the answer is B. I'm a general dentist. I love general dentistry, and I actually do everything, all aspects of dentistry. And in fact, when you go to Harvard, it's known that 95% of the students go to specialty schools. It's known for a stepping stone to go to specialty schools. I think I was one of the 2 students who never pursued specialization, and you know, I mean, that's what I wanted to do. So that was like my specialty, a general dentist.
Wow, that's really interesting story, especially nowadays that there is this whole competition that people want to specialize, and I think general dentistry is still a very important and integral part of the dentistry, as people who are at the front tiers of the dental practice, and they are the ones who decide whether any specialty treatment is needed or not. So that's a really important specialty, I think, on its own, as you mentioned. So our next question for $1,000 is, how do you use your own experiences to connect with patients who are coming from diverse backgrounds? So this can be either from different ethnicities or racial backgrounds, or people who have no knowledge about dentistry, or people who are so foreign with dentistry and who don't match to your typical patient population. So how do you use your own experiences?
That's a fantastic question. And it's something that we use still to date. I think what works for me is that I have to make things very simple for the patients, be very patient with them, and really listen. You really have to have good listening ears to see what their concern is, their complaint is, what they want from you. What is it, you know, is it a aesthetic concern? Is it pain on chewing? Is it, you know, do they want to keep their teeth? Do they want to get healthy? What is it that they want? You know, and if you really take the time to listen, you'll be surprised. People want to keep their teeth, you know, they want to invest in their health, but you have to help them get through their treatment plan.
Wow, that's a really good advice. As you were saying, listening is one of those big important skills that clinicians should definitely have. Yeah. So our next question, we are going up the ladder. This is $2,000. How many languages do you actually speak, and do you use them in practice with your patients or not? Is it what's your preference about that?
Good. So I speak. I have to think. Yeah. So the answer is 4.
Oh wow.
D.
That's awesome. We already had that, right? So
Yes, yes, I speak four, but I'll be honest, I kind of use three languages of those more frequently, if there is a need, because sometimes patients seek me out or would seek a dentist out based on the languages they speak. So if that becomes a concern and if that helps them get over the barrier or fear, then I will speak in that language. But I predominantly use English unless I get prompted that, it's going to help if I spoke Hindi or Gujarati. And I speak Swahili as well. That's not very popular here, but yeah.
that's awesome. It's good to know. Thank you so much. We're definitely very impressed by that. So, you have questions about your activities outside of dentistry. What do you enjoy doing in your spare time when you're not a clinician?
Yes, that's a very good question. We have, as a mom of two kids and a full-time dentist, I have very little spare time for myself. But yeah, I enjoy cooking. I cook a lot. I make fresh meals for my kids, something that I'm proud of. I like to watch movies, listen to music, and I'm a nerd. If I'm not here, I'll be at a continuing education course, which I miss a lot because we have been Zooming for most of them. So yeah.
For sure, yeah, and especially right now, the COVID situation has made everything online, and it's not the same as the real in-person interactions, as I can imagine.
The hands-on, yeah. We miss the hands-on a lot,
sure.
yeah.
Yeah, so our next question for $8,000 is, how do you maintain your work-life balance? Because as you know, this is always the biggest struggle for people who pursue academic careers and fields like dentistry and medicine. And also, I mean, we are fortunate that in dentistry, we can achieve that work-life balance, but do you have any tips and advice for how to have that sort of balance and make sure that we can not only achieve our career goals, but also we can have a very balanced life?
Yes, that's like the $1 million question right there. And especially for women, I feel that we wear many hats, and I know of men too. They have, we all need to have a work-life balance. My best tip would be, don't let your practice run your life, which is what happened the first 10 years. We have to run the practice. So putting more control in the practice, don't sign up to work 6 days a week, don't open 7 days a week. Or if you are open 7 days a week, have somebody else work for you. Yeah.
Sure. Oh, that's really good.
Yeah, so it's like, it's very important to have boundaries and control as to what you would like. Like even my work day, I make sure that I start at a time that I like and end at a time that I like.
No, that's a really
and in every quarter, evaluate if I feel that I've been really working hard and very busy, I have to make a decision to take the time off. Or if I want to put in more time because I haven't been doing other things, then it's my choice. So I like to be in control over my practice and what I do with my family and my family time. And it's totally achievable, but you have to be mindful and make it a priority.
For sure. And Elise has actually a question right now that she would like to ask.
So I was wondering if you find, in related to this question, does owning your own practice, does that create more of an ability for you to maintain this balance, or does it pose more added stresses? But again, on the other side, as an associate, maybe not being your own boss is what is limiting your work-life balance. So I'm wondering what the difference between being an associate or your own boss and how that relates to your time and your scheduling.
I'll have Rusbe repeat that for me because I didn't hear that.
For sure. So basically, the question was about whether working as an associate or as a practice owner would have an effect on you achieving your work-life balance, and what's your recommendation about that? Because on one hand, that is the idea that as a practice owner, you have so much more to deal with, but at the same time, you are considered your own boss. But on the other hand, being associate gives you possibly more free time. So there is always a question that which road, based on your experience, it's better for achieving an optimum work-life balance. Is that your question, Liz?
Yes, exactly.
Okay.
Yes, fantastic question. Thank you for repeating.
No problem. Yeah.
Yeah, definitely something that a lot of us contemplate and have to go through these two stages. In my opinion, it's a personal choice, but my recommendation would be an associate initially to really learn the ropes of the practice, staff management. The business aspect is what is difficult for most dentists. It's not the clinical skills, it's the patient management and business management. So really learn from a mentor, a senior doctor, and a good busy practice with good protocols in place. Maybe 2-3 years later, you can be and be a practice owner, because I feel just as your practice owner has a lot of stress, but if your personality is that you want to be your own boss and you want to own the shop, then ownership is best for you.
For sure. Liz, did you hear the answer?
Yes, I did. I think the sound is a bit.
Yeah. So the sound. So basically, I'm just going to repeat what you said. Is the idea that it really depends on your style, but for the first few years, it might be better to practice as an associate to learn the ropes. And alternative, at the end, you can sort of make your way up to a practice owner where you know how things are going. Yeah. So yeah, maybe you've been caught up at the end.
Similar suggestions, and I think it's important to have the associate experience so that when you do choose to open your own practice, you come in with some additional knowledge.
For sure. Yes. So we will go for the next question. Can you tell us that what does a typical day look for you as a general dentist in your office? So
I should get paid for this question. Really paid for this question. See work. I wish it was eat, but it's not. I missed lunch today, so it's
wow. Wow. Thank you so much for giving us your time, though. We know how busy you are.
Yes.
So,
no problem.
I guess the next question for you, you would be, what do you, I guess you kind of alluded to that earlier on, but what's the most challenging aspect of your role as a clinician who also tries to balance other roles in their lives? So what do you find the most challenging? Is the patient management, I guess?
The most challenging part has been the big part.
Oh.
The insurance and businesses really are, if you're not careful, they will limit what you can achieve. We have to remind ourselves that comprehensive dental care, comprehensive treatment plans, health of the patient is paramount. Our focus, our purpose has to be very clear, but sometimes, whether it's the college guidelines, IPAC guidelines, CDHO guidelines, all the guidelines under the planet, and insurance limitations really sometimes, forces you to be in a box. And we have to, be mindful of the boundaries, but always focus on patient care and wellness first.
For sure, that's always the top priority. And as you were saying, balancing all these guidelines and the requirements and the business aspect with having the patient as the top center of everything is definitely difficult. So the next
a quick question, if that's possible. So I was wondering, have you ever taken any sort of business courses or seminars to help you prepare for all these insurance issues and just general management of your own practice? Or was it more of a learning on the job as you went?
A little bit of both. I took a lot of practice management, customer service, skills, public speaking, like a lot of other soft skills. There are lots of courses through the ODA and the Spring Clinic and other conventions. in other labs and organizing, or other specialists putting it up. So there were evening programs, full day programs, and I also did management training through the MGE training. I did a program through them, so that really helped me actually to handle the different aspects of private practice.
Awesome. Thank you so much. So our next question is for $64,000. Is, as a diverse individual, as a person who has come from a different background, did you experience any challenges along your journey? Being that, for instance, you immigrated and then you sort of like you studied in Harvard. Did you experience any challenges on your journey to becoming where you are right now? And if you did, how did you manage it, or how did you cope with it?
This is very interesting. I'll be honest, if you face difficulties because of, being a woman or of color or, any of those things. But one thing that most people don't realize or about is I'm left-handed. And that, believe it or not, was the most challenging thing because I lost jobs because of my left-handedness.
Wow. That's
yes. Yes, and I remember my very first when I did the examinations. Yes, the NDET that I had to take when I moved from Harvard, and I was waiting for the results. But meanwhile, I was interviewing, and I happened to have a fall, and I fractured my left arm, and I couldn't make it to the third interview when we called from the hospital telling them that, this is what happened. I fractured my hand, my left hand. And they called me back that evening that, oh, we're so sorry, but our ops are all right-handed. They're not ambidextrous, and we cannot accommodate you.
Wow.
And since then, on every interview, whenever as an associate, when I was interviewing, I would have to mention it to them. I never thought I'd have to, but I had to over the phone, even before I went to see them, because I didn't want to waste their time or mine. And I was limited. And the interesting thing, you're taking me back many, many years ago now, but one of the first associate shifts actually ended up, I went there, and I was shocked because the principal dentist actually asked me to work from the right-hand side because she did not want to move the curing light the other side. So imagine, I'm like, are you serious? It's like, yeah, I'm not going to move the curing light for the assistant, so you're going to switch. I say, you know what, there is a patient waiting outside. Because the patient already arrived, I will see that patient, thank you, but no thanks. And I left because you just can't do that. So that was very challenging, and that's
definitely. But I think that's a good lesson in knowing when something is a good fit for you and when it's not. Just being able to make that decision. I think it's a great lesson.
I'm left-handed as well. So
you understand, we are special.
So right now at the University of Toronto, where I'm in my third year of studies, we do have the chairs that they can actually rotate. So we rotate it, yeah. So it's like it has you can either use it as a right-handed, moving everything left, or moving everything to the right. So yeah, but that's definitely
very good.
Yeah.
Yeah, because I just did my implant residency last year, and we had to do live surgery, and we had to go to 2 hygiene schools. There were 50 ops in each school.
Yeah.
All the 50 ops, all of them were right-handed.
Wow.
Surgery, yeah, they didn't have a single ambidextrous or left-handed or hygienist.
For sure. Wow, that was an interesting story. So the next question we do have is about your location of practice. So we know that you practice in Mississauga, but why are you practicing there? Why did you choose that area? Is there any specific reason, or was it just you liked the area?
I mean, this one was
Oh, okay.
Pearson, then we went home. It was in Mississauga, and I was looking for associateships close by, and then my first practice and the second one both happened to be in Mississauga. So yeah.
For sure.
Not particularly is the reason, but that's all I know. Mississauga is all I know.
No, that's really interesting for sure. Yeah. So, how do you? I guess our $250,000 question is about your involvement in the community, rather than being a clinician. So, do you participate in any oral health events? Do you give lectures? If you can expand a bit more on that, we would appreciate it. Yeah.
Thank you. This is my favorite question. I love community involvement.
Elizabeth, can you put it on speaker, please?
Sorry?
Yeah, it's good. You can continue. Yeah. Sorry, the voice was cut off suddenly. Yeah. Do you hear us? You can just speak.
Okay.
Yeah. Yeah. We hear you.
So,
Yeah.
you hear? Okay. Yeah. So I've gone to different schools, and I've worked with children for preventive oral hygiene projects, lots of them, lots of different schools. I've done senior centers, and I've spoken to seniors and create health awareness that way. I've done bridal shows. I have done other local community events. Even during the COVID time, we actually went to the Trillium hospital and donated to the nurses there. And, we wanted to be their front line. So if they had anybody in the hospital had a dental emergency, they could contact us because they wouldn't know where to go. So we have constantly been, and we support a lot of different causes. We donate. We just donated 65 face shields to a local church for their choir group. We support the Period First, which is for like menstrual equity for women in Toronto. We are, I think, donating backpacks next month to children. I'm doing all sorts of things, and I love it.
No, for sure. That can be really satisfying to be able to give back to the community. That's a very important feeling. And I feel like that's what people who are in a position to donate should always consider, because it's just more than the monetary aspect. It leaves a really good feeling for the people and makes sure that people are taken care of at different parts of the society, not just in the dental field, but also others, as you were saying.
Yes.
So our next question is about the COVID-19, which is number one topic in news. But how do you think that has impacted the work of a dentist? There are different ideas. Some people say there are many protocols and they're contradicting with each other. Some people say it's actually like they are not enough. There should be more guidelines. So what's your view on that? How do you see COVID-19 impacting the dental field, and specifically your job as a dentist?
I feel that many protocols, definitely lots of, it's different now. We have lots of extra steps. We have active screening. We have, fallow times between patients. We are encouraging use of hand sanitizers. We have made changes, plexiglass installations, tapped through the plexiglass. We have hand sanitizer stations throughout the office. We have air purifiers, which are, expensive equipment that we have invested in. There have been guidelines by the college, but definitely confusing guidelines. The hygiene college has their own set. We have our own set, and there's constant, discussions and debates as to how we can best maneuver through these challenging times. But we're actually busier than ever. We have a lot of backlog. We're working very hard. And just trying to make sure that, we catch up on all the things that the patients, were left neglected for a long time. So we're just trying to get everybody's health back on track.
For sure. So Liz has a question. Yeah, Liz, go ahead.
Yeah, so I was just wondering if your practice closed down because of COVID, or if you were open for a few emergency cases, and if you were able to keep in touch with your patients maybe and give them some tips on oral hygiene in the meantime if you weren't able to see them.
That's a very good question too, Liz. For the first 5-6 weeks, I think we were all paralyzed. We were all frozen. We didn't know what was going on. The 3 weeks became into 3 months, and things were very chaotic. So we were busy at that time getting our PPE and getting things in order. The office, we were always open. We had 3 staff members working from home, so we were in constant touch over the phone. We established text systems, so we were sending videos, YouTube links, texts to keep in touch with patients, to let them know that we were available for emergency. So first 6 weeks, I wasn't able to provide emergency services, but starting April, we have been open. I was providing emergency dental services and listed with the college to be able to provide. And one thing that we did very different was we actually invested in Zoom, the tele-dentistry, so the virtual consult. So we had a HIPAA compliant virtual tele-dentistry established through our website company. And the one thing I was doing a lot was this, talking to the patients. It was different not to be able to examine them, but some of them had cameras, intraoral cameras that would zoom in to try to show me what was going on in their mouth. And about 60-70% of the calls was just reassuring them, because people were panicking. And as you mentioned, most of the offices were closed. They did not know what to do or where to go should there be an emergency. So I was doing free consults, actually. We published an article and we were advertising free virtual consults for anybody in the community who needed help. And then whoever had to, so we triaged them, and then whoever I had to see to treat, I saw them and treated the emergency.
And I think patients really appreciate the fact that you were offering them consultations, even on a free basis, because when the dental pain hits, it can be really challenging for patients and it can be really devastating. So knowing that there is someone to answer them, that was a really big thing. So thank you for doing that. I think your patients should really appreciate it.
Thank you for appreciating.
Yeah. So the next question, which is our final $1 million question, well, maybe not the $1 million, but any fun or exciting stories that you would like to share with us, either in your field as a dentist or outside of dentistry, that you think for our audience would be interesting?
Wow, I was doing so well. I don't want to lose the money.
So
there's a lot of stories.
Yeah.
Maybe an interesting case or patient.
Maybe like from your dental school years. Do you have any interesting stories? Anything that happened that you remember from the years you were a student and seeing your patients for the first time?
Oh my gosh, yeah, you're taking me long time back. I'm old. I think I don't remember.
No, it's totally fun.
I don't remember anything exciting stories. I think I told you about my left-handed story.
That was pretty exciting for sure.
That was very different.
Yeah.
But
I guess that would be enough if you don't remember anything.
And also, if I may follow up, I mean, in my opinion, I think that attending Harvard is very exciting. So is there anything you could touch on about the experience of being on that campus, which is world-renowned, and just being able to collaborate with people?
Thank you for reminding me, because that's one thing I actually wanted to say when I was first talking about it. That, thank you, Liz. You read my mind. So, one thing for sure that Harvard is known for is, the student to teacher ratio is the other way around. You have more teachers than students. It's one of the smallest dental schools. There's 32 students, or at least there were back then. And there were hundreds of teachers, because you have the medical school, the School of Public Health, and all the research institutions around, all the hospitals, Mass General, Brigham. It is so much resource. You learn so much from all the people you meet. The faculty is very interesting. They're very knowledgeable, And you really have to, up your game, and you have to have it together to be with, to be on par with the rest of the crew. And I had wonderful friends. I'm still in touch with them on Facebook. Yeah, not Instagram. So that tells you how young I am. But it was definitely a lot of resource, a lot of there's the Joslin Diabetes Center, Children's Hospital, Brigham. So the rotations we had at different institutions helped enrich the program. Being on the him oncology ward, you learn so much that's very different than just routine private practice. Walking around with your instruments in your pocket, almost your autoclave instruments when patients are hospitalized and they have a surgery, but they need a dental clearance because they have fever of unknown origin, and you have to do treat patients bedside, order portable x-rays, work with whatever you have to get that infection out, and they need your signature, your clearance before they can have a heart or valvular replacement. I mean, that was very interesting. And,
for sure.
So that makes up for an interesting story. I learned a lot.
So, Dr. Kotecha, I've heard in Harvard, people are divided into groups based on the names of famous physicians and dentists, I guess. So, do you remember which group you were part of and how that experience worked out?
I was a Canaanite. I was in Canon group.
Oh,
you've done your research.
Yeah. Wow. And how that worked? Do you remember anything? Like, was it based on the lectures you were taking or the instructors you had? How did the grouping thing work?
That was, that gives you that camaraderie that you're not, like as in private practice, you're working alone. When you are in smaller groups, you really bounce ideas off of each other. And when we have a treatment plan, like that was the most beneficial thing, that we could treatment plan the same patient in so many different ways, and learning that what works, what doesn't work, and your mentor guiding you. And we had weekly meetings, and we would do chart reviews and even follow-ups, like, if you do a procedure, what went well, what didn't go well, what could you have done different. So that was very, very beneficial.
For sure. And I feel like Harvard is like among those, it was the first school of dentistry which was affiliated with the university for the first time. And I feel like that's a very special place because there is more emphasis on the medical aspect of dentistry than just the technical aspect, which is
that's where the DMD, I believe that the DMD of medical dentistry, the dentistry is a subspecialty of medicine.
That's
their thought philosophy is very different.
For sure. And that's a big thing. And I feel like even though these days they say that all dental education is the same, but I still think in those universities there is more focus on the medical aspect than, let's say, at other universities that they have separate dental schools and everything is separate. So thank you so much, and we learned a lot, and thank you so much for giving us your time. And thanks for making it through these difficulties. I mean, it was very difficult experience, but thanks again, and we know how busy you were.
Thank you, Liz. I am so excited. Thank you for having me, and I'm excited to meeting you soon under
for
the
sure.
Women in Dentistry mentorship. And I'm here anytime. Just an email away.
For sure. Thank you so much. We will be in touch. Thank you. Have a good night. Bye.
You too. Bye.